All right, so let's dive right in. We're going to unpack the real evidence for natural remedies when it comes to painful periods. Primary dysmenorrhea.
Right.
And this is a huge issue because conventional treatments, your standard pain relievers, they fail for about 20 to 25% of people.
That's a massive number. It leaves so many people looking for something that actually works.
So that's our mission today. Find the evidence-based alternatives.
And it's so important to start with the why,
Yeah.
the actual mechanism. Primary dysmenorrhea, or PD, it's pain without an underlying disease like endometriosis.
Oh, so it's the pain itself that's the primary problem.
Exactly. And the root cause is biochemical. It's an excessive release of something called prostaglandin F2 alpha.
And that causes what? A couple of different problems.
Two big ones. First, intense uterine hypercontractility. That's the awful cramping. And second, uterine ischemia.
Ischemia, so a lack of oxygen.
A lack of oxygen to the muscle, which just makes the pain so much worse.
So the goal, really, for any treatment is to knock down those prostaglandins.
That's the therapeutic target.
Yeah.
And today we'll move from, physical interventions to supplements and then some really potent herbal agents for acute relief.
Okay, let's start with the physical side. What does the science say is the single most effective thing you can do?
So hands down, it's structured exercise. The data it's just incredibly clear on this.
How clear?
It has the largest effect size. We're talking a Hedges G of 2.16, which is huge in clinical research.
Wow. And how does that work?
It's endorphin release, your body's own painkillers,
Right.
and improved circulation, which helps clear out all those inflammatory prostaglandins. And interestingly, relaxation-based exercises had the best long-term adherence.
That makes sense. Okay, so if exercise is the foundation, what about the classic remedy? Just, a heating pad.
Thermotherapy is surprisingly effective. Meta-analyses show external heat is basically as good as, and sometimes even better than, over-the-counter drugs.
Better than something like ibuprofen?
Potentially, yes.
Yeah.
The effect size for pain reduction was really robust, a G of 0.48.
So after exercise and heat, what's next in the hierarchy?
Well, you see moderate effectiveness for things like self-administered massage or acupressure, but really the data points you to a clear 1-2 punch. Exercise first, then heat.
Okay, that physical foundation is key. But let's shift to the things that work more like medicine, the anti-inflammatory agents. For that immediate acute relief, what's at the top of the list?
Ginger. It is, biochemically speaking, very similar to NSAIDs. It directly inhibits that prostaglandin synthesis.
But I'm guessing we're not talking about a little ginger in your tea.
No, absolutely not. The dose has to be therapeutic. For it to work, you need 750 to 2,000 milligrams of standardized powder a day, right when your period starts.
That's a serious dose. Any others?
Yeah, cinnamon at 840 milligrams 3 times a day, and also fennel, which is a great antispasmodic, both shown efficacy that rivals conventional drugs.
And for a long-term preventative strategy?
That's where you look at omega-3s. But they have to be taken daily, around 1,000 to 2,000 milligrams.
So they can build up in your system?
Exactly. They incorporate into your cell membranes and just lower your overall baseline of inflammation. And then there's magnesium.
A muscle relaxant.
A fantastic, natural, smooth muscle relaxant. 200 to 400 milligrams daily can really help ease those uterine spasms.
And vitamin D, the data was very specific there.
Very specific. It's really only shown to be effective for patients with primary dysmenorrhea, often if they're deficient. It's used as a high-dose repletion therapy.
Something like 50,000 IUs a week.
For about 8 weeks, yes. If you can make a significant difference.
This brings us to a really critical point: safety. These are powerful substances, and they can interact with prescriptions.
They absolutely can, and this is non-negotiable. Many of these natural anti-inflammatories work by affecting platelets, which increases bleeding risk.
So that's a critical warning.
A critical warning: omega-3s, ginger, turmeric. You must not combine them with prescription anticoagulants like warfarin or Eliquis without strict medical supervision. The risk is severe.
Okay, that is crucial. And you also flagged a really urgent warning about those high-dose vitamin D protocols.
Right. High-dose vitamin D can lead to hypercalcemia, which is a dangerous level of calcium in your blood.
And that's a problem if you're taking certain heart medications.
It's a huge problem.
Yeah.
For anyone taking digoxin, it dramatically increases the risk of fatal cardiac toxicity. It also messes with blood pressure meds like calcium channel blockers. You absolutely need clinical oversight for this.
So what's the bottom line for you listening? The evidence really points to a smart, tiered approach.
It does. You start with exercise and heat as your foundation.
Then you add in magnesium and omega-3s for long-term prevention.
And then you use those specific high-dose phytoagents like ginger for the acute pain. But all of it, and this is key, under professional guidance.
Right.
And, it makes you think, when you have standardized herbal extracts like ginger, that can actually match the efficacy of pharmaceutical NSAIDs in clinical trials.
Mm-hmm.
It just raises an important question. How much longer will we call these agents alternative? At the end of the day, they're just another source of true pharmacological agents. It all comes down to the science of specific dosing.